Hello, and how are you? Welcome to my session on palliative care team members. My name is Winnie Barawa. If you're new, this is a platform where we do lectures, notes, lessons, and also expert interview in areas related to healthcare. If this is an area of interest, kindly remember to click on the subscribe button and click on the notification so that you can know when we post our next lesson. So, in today's class, we are going to check into the palliative care team members and also look into which roles do they bring on board as we take care of the terminally ill patients. So first of all, the team is very wide and sometimes the composition of this team can vary based on either the severity of the patient or sometimes the institutional provisions in terms of palliative care. However, this is just a general list that can guide you in case of you planning to develop a team for your palliative care patients. So in any team, you might find a physician, can have an advanced practice provider, can also have a registered nurse, a social worker, pharmacist, medical assistant, and also you can have dietitians or nutritionist. Patient him or herself is part of the team, and we have the family members who are very critical at this age, at the end level. Then we have spiritual advisors, community health workers, and you can have the front office staff who will guide in documentation and so on. So this is a team, and like I said, it's broad and the composition can vary based on the facility or the provisions of the guidelines from the different associations. So when you're developing the palliative care team, of course, there's a patient that you're going to work with, but which patients are actually beneficiaries from these palliative care teams? So you can work with high-risk patients. These are patients who are suffering from high-risk illnesses that have prone to complications and can lead to death. And then you have the socially vulnerable persons, can have exhausted family caregivers, patients who have cognitive impairment, multiple comorbidities, frailty, or functional dependency. The other client who can benefit from palliative care could also be clients who have cancer, and this could be advanced lung cancer, heart, kidney, or even liver diseases. Other team is AIDS, can work patient also have Alzheimer diseases and dementia, can work with cystic fibrosis, and we can also work with patients who have disabling stroke and other neurological disorders. So these are several clients that actually can qualify or be placed in the palliative care caliber. All right. So among the team members, we mentioned that there is a registered nurse in the team. So let's see which roles the nurse plays. So number one, the nurse is very key at providing care that is aimed at symptom management, and particularly in this case, we're talking about pain. And in management of the pain, the nurse will focus more on pain assessment using the pain assessment tools and management of this pain using different methods, which could include either pharmacological and also even other non-pharmacological management. Then the nurse will be working with other interdisciplinary team to provide optimal care to this patient. The nurse also works to establish a caring relationship with both clients, relative, and also family. But at the end of the day, the key role of the nurse in doing all this is to promote quality of life. Second member of the group is the physician. The physician, more in the palliative care, is the lead member who actually will prescribe medication for pain and symptom management. He will also be key in making the medical decisions and information management. This is the case of passing information on prognosis of the disease, passing information regarding how the information is going, how the disease is going on, the stages and all that. The physician also will coordinate and collaborate care with other providers in the team, but he will also work along to address social, emotional, and spiritual needs of the patient. So he works more in a team setup. So this is not like a one-man show per se. It's a teamwork, and so you realize their roles and responsibility are a bit similar. They're not so single as opposed to how we see in other departments. But the main focus for all of these team members is pain management and symptom management. Apart from giving information, collaborating, and addressing the holistic needs of this client that is spanning from social, emotional, and even the spiritual needs of the client. So moving on, these are other team members that are part of the team. So in advanced care, we find that there are specialized practitioners where you can have even pain and symptom management director. So he will provide support for the caregivers in terms of pain and symptom control. So the physician comes in more as a consultant who works but does not replace the main physician for that role. The pharmacist is there for medication preparation. The dietitian or nutritionist will be working to take care of the nutritional care plans and needs of the client, while the naturopathic doctor will assess the patient needs and develop any needed naturopathic care plans. Occupational therapist, he is important in maintaining the quality of life through helping the patient become independent in terms of daily self-care and leisure activities. The physiotherapist, on the other side, provides pain management, improves physical mobilities, and helps with wound management. Respiratory therapist, this is cases where a patient is presenting with respiratory complications such as difficulty in breathing. They come in and assess the difficulty in breathing and oversee any need for respiratory equipment. Language pathologist come in more to assist with communication and language needs for the patient. And you can have complementary therapists and team members. This could include massage, reflexologists, aromatherapists. All these come to assist with giving alternative medicine or alternative management for the client in case they're actually needed. So we have to appreciate that working in a palliative care team could also be challenging, or the palliative care uh, ground still has many challenges to be sorted, but this opens a ground for opportunities. So I will discuss the challenges first that are cutting across, and then the possible opportunities that we can gain from them. So the first challenge is shortage of palliative care specialists. This is an upcoming genre or specialization and may not find a lot of people specializing in that area. But again, there is lack of knowledge of palliative care still exists with some providers. Some people still don't understand, or let's just say part of the medical or healthcare providers may not adequately understand how palliative care can best be administered. And then we have regional, socioeconomic, racial, and even ethnic groups influence access to palliative care. There's still hierarchy gaps when it comes to access to palliative care services, because you find that with the palliative care, most it's treated as whoever can afford then goes ahead with it. Insurance companies are yet also to embrace palliative care as part of the package for insurance, and this becomes hard. So it creates this socioeconomic gap, especially for those who cannot afford it. And the other bit is care team members may be reluctant to discuss palliative care as they hope or fear that a patient may lose hope, or they may lose positivity when it comes to the management to a certain disease, because most clients assume when they've been given the progress that they need to proceed to palliative care, then they start feeling that that is the end of life, and so they may not have the zeal or the energy to just progress on with further activities of life. And I need to understand that also many patients are unaware of palliative care services. They don't understand what they are, what they entail, or how best can they harness from them. So these are several challenges, from lack of enough specialists to lack of knowledge, regional and socioeconomic gaps, uh, fear of discussing palliative care services, and also looking at the patient themselves who have knowledge gap and do not understand much about palliative care services. So what opportunities can we therefore leverage on? So number one, we have opportunity to increase access to palliative care as part of our primary health care services. Apart from having the main frontline consultation rooms, we can also open palliative care consultation room. And then the other bit is to develop communication strategies to help patients through decision-making processes. And you can also leverage on technology to facilitate appropriate referrals. That is enabling a patient to understand that apart from the normal referral system that the patient know, they can facilitate through other methods, that is going for palliative care or seeking support services from the facility. And the other bit is educating all providers and staff about palliative care. that they can become aware and embrace it as part of the management for their client. And lastly, we need to increase on patient satisfaction while reducing the provider burnout. This is an opportunity where we can work with our client and understand that when the curative services are no longer responsive or the prognosis is not good, then you can encourage patients to embrace palliative care as part of the positive management for critically ill illnesses or diseases. So thank you for staying with me to the end. If you've not yet subscribed, kindly subscribe or click on the subscribe button and click on the bell, which is the notification button, that you can be informed when we post our next lesson. Till we meet again, bye bye.